Hey everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about a really popular procedure called microneedling. So microneedling is not really such a new concept. We've had it around for a while, and it's based on the concept of creating little tiny controlled wounds throughout the skin to help the skin regenerate, make new collagen, get rid of some of the damage that's occurred over time, and really allow the skin to kind of heal itself in a really controlled manner and to remodel itself. So microneedling was initially introduced with these rollers. So they were these rollers and they had pins on them. And when I started doing this, it was called collagen induction therapy. So you may still hear that word out there, collagen induction therapy, with the rollers. And so we would roll these needles along the skin, and it would create pinpoint bleeding, and it would cause those little dots of damage throughout the skin, like little wounds that were created. But now we're using what's called microneedling pens, and these pens have cartridges that sit inside of them. They're disposable, and there are little tiny needles on the end, and basically it oscillates back and forth for you. So instead of rolling it along the skin, we're able to just glide the pen over the skin, and the needles just automatically come up and down and then create the little wounds. Now there are a few advantages of that, and I'll just show you here really quickly. So when we were using the roller that had the pins on them, it was creating wounds that were a little bit wider and broader and larger. We were seeing really great results, of course, even with this technology, but it was just a little bit more of a bloody procedure, and it caused a bit more downtime. And then when the fractional lasers came about, like Fraxel laser and ProFractional, then we pretty much stopped doing this kind of a treatment, and found the lasers just to be a more elegant application. But now with the advent of the microneedling pens, we are back into doing microneedling procedures and causing those little wounds to form in the skin. Now we can set the pen to different depths. So if you want to treat more superficially for pore size and just reach more the upper epidermis, we can do that, or we can set the tips to go a little deeper into the skin. The needle depth can be set up to 2.5 millimeter on our pen, and that really gives a nice rejuvenation of the deeper collagen in terms of wrinkles and fine lines and so on. So microneedling is a good tool for overall skin rejuvenation. It does have a benefit even on pigmentation in the skin, which is interesting, and it has also an application in being able to help with some of the milder active acne. It's great for stretch marks, and of course, like I said, for pore size, fine lines, and wrinkles. So here's some examples of what microneedling can accomplish after a few treatments. We can get results like these, where the skin just looks healthier, it looks more rejuvenated. Your skincare products that you apply to your skin are going to penetrate better immediately post microneedling, so we do recommend that you get on some good skincare along with this. Additionally, we can use your own blood with a procedure called PRP, where we take your blood, spin it down, and collect a platelet-rich plasma, which is rich in growth factors and other substances that help the skin to regenerate new collagen fibers and heal itself. So that, in conjunction with microneedling, we call microneedling with PRP, is a great option if you're able to do that. You just get better benefits. And this is another example of microneedling where you can see a nice improvement even in pigmentation. The one nice thing about the microneedling, unlike some of our lasers, although many of our lasers are safe for all skin types, but with microneedling, because there's no heat generated and it is not targeting pigment in the skin, it is safe to use on patients of all skin colors and ethnicities. You might still want to use a skin lightening product whenever you do a procedure that involves any sort of inflammation to the skin, because you could get a little bit of post-inflammatory hyperpigmentation, but in general, otherwise a very safe treatment to use for all ethnicities. Here's another example. After several treatments of microneedling, you can get some really nice laser-like results even in some cases. So this is a really nice dramatic improvement here on sun damage, wrinkling, and skin texture. Here's an example of a patient with some active acne lesions and a nice improvement afterwards. And again, with the poking through the skin and creating the little wounds, we're able to again deliver the ingredients in the skincare products a little bit better into the skin, and I think that can have a beneficial effect, along with just helping to remodel some of that tissue under the skin and helping to reduce the skin from being so prone to breakouts. Here's another example of acne scars that improve nicely with microneedling. That is one really good indication for microneedling as well. Here's someone with kind of unevenness in the skin, a little bit of active acne and scarring, and you can see a nice change over time when you do several treatments of the microneedling. And here's another example of an aging face after several sessions. You can see how the skin really has an ability to remodel itself if we're able to cause a little bit of injury that forces it to do that. Here's another example of brightening in the skin, improvement in pigmentation and skin texture, more improvements. Kind of that ruddy rosacea look can also sometimes improve with microneedling. Pigmentation changes. This is a male face, and you can even see his wrinkles have nicely improved. Here's another example of forehead wrinkles, and then stretch marks, which is a great indication for microneedling. It may take more treatments than your traditional laser, but we can get really nice results. So when you come in for the procedure, we're going to make sure your skin is clean of any makeup or any moisturizers. Then we'll put some numbing cream on your skin for about 30 minutes, wipe that off really good. Then we'll use a hyaluronic acid serum, or if we're using PRP, then we'll use your own PRP and place that on the skin, and then use the pen to glide over your skin as it's creating those little micro wounds. It's recommended to make 3 passes. At our practice, we often like to make more than 3 passes just to make sure that we're giving you the maximal benefit we can get out of the procedure safely. And once all those little wounds have been created, you might see some pinpoint bleeding, a little bit of redness. The pinpoint bleeding stops within minutes usually, and then we recommend that you use a good protective skincare product afterwards that hydrates your skin and gives you some extra boosted benefits. If you did choose to do the PRP, we'll send you home with some of your PRP, and then you can continue applying that to your skin afterwards while it's healing, and you'll see some really nice results. So, and then usually within 48 hours, your skin is completely healed and you can resume wearing makeup, and then you're on your way to just healthier, more beautiful skin. And so this is a procedure here to stay. Microneedling is very popular, and patients respond well to it. It has a lot of applications, and we look forward to being of help to you. I also wanted to mention that there are home products you can get, and a lot of patients are buying these online now, and they're little rollers, and it's like a microneedling procedure, but of course the pins are really shallow, so they're usually like 0.1 to 0.2 or maybe even 0.3 millimeters, so they penetrate very shallowly into the skin. It may help with the penetration of some of your skin products. So it's okay to use those as a maintenance type of procedure post microneedling or any of the laser treatments. But of course, when you have a clinical microneedling procedure here at the office, it's a completely different procedure because we are going, just to show you this again, we're going much deeper into the skin, up to 2.5 millimeters versus just 0.1 or 0.2 millimeters, which would barely scratch the surface of the skin. So I just wanted to share that with you for those of you who like to use your home microneedling product.